Thank you so much for joining us. It should come as no surprise that there is yet another excellent issue of 7 Days out in the world now. And in this week's issue, there's a very interesting story about the CEOs of Vermont's nonprofit hospitals. Turns out they are being paid a lot more than the leaders of other Vermont nonprofits. In fact, some of them are earning well over $1 million, which begs the question, how much should you be paid for running one of Vermont's nonprofit hospitals? To help us answer this question, I have tracked down the CEO of one of the largest nonprofit hospitals in Vermont, Mr. Bentley McWentworth. Mr. McWentworth, thank you so much for agreeing to be on the show.
I'm happy to be here, Brian.
Sir, it recently came to our attention that you are earning well over $1 million every year. How do you justify raking in that kind of cash while working in the nonprofit sector?
Well, Brian, the nonprofit sector is all about sacrifice, really. And if that means that I have to earn $1 million salary while routinely accepting six-figure bonuses, all to make sure that the hospital doesn't report a profit, well, then that's a sacrifice that I'm willing to make for the people of Vermont.
But sir, you have to admit $1 million seems like an absurd amount of money. I mean, this isn't a private business we're talking about. It's a hospital that's primarily funded with public dollars, like our money.
Well, yes, and seems like is a very important phrase there, Brian. Have you ever actually insured a family of 5? If even one of us came down with the cancer, treating it could very easily cost nearly half of my take-home pay.
But that's exactly the point, sir. The average Vermonter earns considerably less than you. A serious medical condition such as cancer could easily bankrupt them and leave them with a lifetime of debt, even if they have health insurance.
Well, yes, Brian, I couldn't agree more. And that is why I recommend that every family examine their budget and consult with a financial planner before deciding to develop cancer or any other serious medical condition.
Well, ignoring the obvious insanity of that statement, does it really need to be that way? I mean, in the United States, we spend $3 trillion a year on healthcare. That's more than any other country. And 20 to 30% of that goes towards administrative costs, such as your salary. I'm not trying to say your job is easy, sir, but to what extent do you feel responsible for the outrageous cost of healthcare in this country?
Look, pal, I'm only responsible for making sure Vermonters have access to the medical services they need when they need them.
Yeah, no matter the cost, apparently. Well, what would you say to the average Vermonter who's struggling to keep up with the constantly increasing cost of healthcare?
Folks, never be afraid to consider the warm embrace of death. Sure, it may sound extreme, but it is a one-time deal. You won't be faced with all the recurring costs associated with all the other major medical conditions. And that can mean some serious savings for you and your family.
Wow. Thanks for the advice, I guess?
Yes, thank you, Brian. Now, if you'll excuse me, my family is here. We're actually shopping for our 4th home. Yeah, we've grown accustomed to our summer home, so we're shopping for a summer home for our summer home. We're going to summer while we summer. I'm sure you know how it is.
Well, speaking of healthcare, according to a recent study at the University of Vermont, people who eat red hot peppers tend to live longer lives. That's not to say that the red hot chili peppers will make you live forever, but it is an interesting correlation. Now, from what I'm told, eating a red spicy pepper raw is a very unpleasant experience. But luckily for us, there are a number of businesses who are making artisan hot sauces right here in Vermont. We spoke with 3 of them this week, and they allow you to enjoy some of those health benefits without all the discomfort. Now me, I'm a little bit of a purist. I mean, I like to go straight to the source. So I've decided to eat a spicy red hot pepper to show you and myself that it's really not that big of a deal. All right, I'm here with 7 Days production manager and fire safety expert John James, and he's here to monitor me while I do the hot pepper challenge.
That's not really a hot pepper though, Brian. That's just a regular red bell pepper. It's not hot at all.
Okay, I see what you're doing with this reverse psychology thing, but honestly, I can handle it, Johnny. You just be ready with the milk in case things get out of hand, all right?
All right.
All right, to your health. Really not that bad.